Very good morning. We have about 11. I think we will not wait any longer. We are rushing for time here. So we will start right away. So we have two interesting presentations today. We'll start off with the first talk, which is on entomological aspect. Why Aedes vectors are winning potentials of bioinsecticides, presented by Dr. Ravi. So before I hand over to Dr. Rajiv, let me briefly introduce you to Dr. Rajiv. So Dr. Rajiv obtained his PhD in molecular parasitology from University Science Malaysia and is currently a senior lecturer in the Department of Parasitology, Faculty of Medicine, University Malaya. He is a professional technologist certified by the Board of Technologists, MBOT, and serves as a Malaysian MBOT panel assessor. He is a distinguished researcher in medical entomology and vector biology with strong expertise in Aedes mosquito control, insecticide resistance, and plant-based bioinsecticide development. His research focuses on training his research focuses on translating botanical resources into sustainable vector control strategies, including Areca catechu-based larvicidal innovations. His innovation portfolio has achieved significant international recognition, including gold medals at ITEX 2019 and the Malaysian Technology Expo MTE 2019 for the nano-azo mosquito control technology. His work has also been featured in national media coverage, including Berita Harian, highlighting its contribution to dengue vector control innovation and translational public health technology. He holds intellectual property rights under patent and copyright, reflecting his contribution to applied research, product development, and innovation in public health entomology. So without further ado, Dr. Rajiv, the screen is yours.
Thank you, Dr. Arun, for an extensive introduction. Welcome everyone for breakfast session with current discussion topics that we're going to have it today. Even though it's a virtual breakfast, I hope that I can make my presentation as as effective and as simple as possible with less technicalities. Well, my topic today, it's why Aedes vectors are winning and the potential bioinsecticides. So what are we talking about when you talk about Aedes vectors, right? So especially in Malaysia, if you look into it, it's just until the November's data, okay? If you just look into until November's data last year, all right, that's about 47,000 cases. And comparative to other countries, okay, if let's say we talk about Japan, okay, even one or two cases, they get panic. And those countries, they will do all these preventative measures, control measures, so extensively. But in Malaysia, we have a lot of cases, okay? It's a tropical country. The weather is well deserved for the replication of vectors, the weather is very good for the vectors to breed and also, to bring this disease to us. But why Selangor alone, if you look into it, it's like 40% of cases from Selangor, okay? The two main vectors which is important for dengue transmission is Aedes aegypti and Aedes albopictus. The primary vector is Aedes aegypti and the secondary is albopictus. So these are the two pictures that you can see in my slides I've presented. Two types of vectors, two types of mosquitoes, which is actually quite prominent in Malaysia. And the cases keep rising, even though we have some control measures, okay, a lot of things, it keep rising. Just for a few months back, even in the cases in my community, if you can see, children who are actually getting the cases admitted into ICUs, and also like so much of cases, but even though if they recover and things like that, but still, that this kind of situation where you can see, several cases into ICU and these kind of conditions. We do have mortality cases. However, in Malaysia, we do have a good system, the iDengue, which is provided by the KKM. So any cases which has been reported, okay, in Malaysia, of course, it's been put onto the iDengue version websites, that you can always, check into what are the hotspot areas, and then from there we can also do some research, or we can work on it. And also it's an information website for people who are staying in that area to be more cautious, and to have some personal protection measures that you can do to prevent this infection of dengue. And then all this is also into what you're going to talk about today, is also is fully is going to be focused on the vector control. Now, in this website, for example, if you see, they have listed out for you all the states, the number of cases reported, cumulative number of cases reported, and also you can actually scroll down to the hotspot area that you're going to focus on and things like that. Even though we have fogging, we have intervention of vaccines today as well and all that, but why the number of cases is so high? Okay, it's keep increasing. Why these vectors actually keep winning, what's happening behind the I'm sure that if you have any cases, you could hear the sound of fogging. Okay, sometimes even in in office, we can hear the sound of fogging and all these things happening. Despite all these factors, why? Okay, it's because of resistance. Okay, and also let's bear in mind, when you use chemical and all this, it's also pollution, okay, for the environment and all that. So there are a lot of things. Okay, in the house you can use aerosol sprays, things like that. You can apply it to the mosquitoes, but mosquitoes being mosquitoes, they will actually develop resistance. So the development of resistance in mosquito is actually a big story. Okay, and we have a lot of types of insecticides. So many manufacturers out there. Okay, it can be from Japan, it can be from US. Okay, there's a lot of marketed product out there. So commonly used in Malaysia is actually pyrethroid. So to be much more focused, if you look into the if you look into the bottles given, we did not for presentation purpose, we did not expose the brands, but if you look into it, it's mainly everything is actually on pyrethroid base. Okay, why? I think the safest option so far that we have, and also quite commonly used extensively in the fogging and all that. However, for larvicides, we have organophosphates that's used as larvicides, and we also have BTI as a biological control, been used in Malaysia as well. All this, but I think all these, some of the larvicides, if you have to purchase it by yourself, and you have to apply it in your homes and things like that. But the fogging materials that you use, extensively, is actually all based on the mostly is actually on the pyrethroid based products. Okay. Now, when we talk about resistance and all that, it's actually chemically synthesized insecticides that's been extensively used in Malaysia. However, in other countries, if you look into it and all that in details, okay, before we go to other countries, if we look into it in detail and all that, this is a very good review article by Professor Datin Indra Vaidyanathan, our researcher, in the Department of Pestology. So I think she wrote a very good article in the journal. It's about the dengue vector control in Malaysia. Are we moving in the right direction? Okay, this is a word to read article. So I've shared here, and then of course her students have worked tremendously on the resistant control in previous years and things like that. So what's happening is actually house-to-house larvae surveys that's been taking place in the current control techniques. But in her paper, in Prof. Datin Indra Vaidyanathan's paper, she was talking about active surveillance, especially in looking into the adult mosquitoes, and also in identifying, the viral in the adult mosquito itself. Okay, whether we can do it on the spot and all that through the sticky traps and things like that. It was very interesting. Okay, so it's worth of read. And and also she talks about the insecticide resistance and things, because extensive use of chemicals and all that, which cause the insecticide resistance. And moving on further, so in our study, this is recently published on December 2025, that looking at Prof. Datin Indra's publications and things like that, we also want to know what is the status now. Okay, are we getting better, or is this vector is having more resistance now? And we have done some surveys, and I think my students have done some work on the resistance, and also we have found that it's still there. Okay, the resistant problem is still there on the Aedes mosquitoes, and of course we work towards some innovations with rather than relying on chemicals. Can we go for these biological insecticides or not? So we worked on that. What keep motivated and all this, because of my previous industrial experience. So when we look into industry, yes, in other countries, this is actually from taken from the website. It's there. Okay, other countries they're still they're using bioinsecticides. This is a country in this is from the manufacturer from US. Okay, they're actually called McLaughlin King's company, and they're having all these products, and it's been used in their country as well. Okay, all these are actually plant extracts, and of course they have the mode of action in the insects, in the mosquitoes, the Aedes mosquitoes, and the types of plants that they have like worked on and things like that. So with these examples and with this direction of how the industry is moving, we are also trying to find some solution based on the bioinsecticides. Of course, there's pro and cons using bioinsecticides. Okay, everything has pro and cons. But what are we really targeting here is actually to work with the resistant mosquitoes and also to reduce the number of cases due to these resistant mosquitoes in the hotspot areas in Malaysia. So our study was actually focused with a few types of plants, okay? Locally, okay, available, like this is actually Penang, okay, locally available in Malaysia. If you know, this is actually from Penang. So you see, all this work is actually an ongoing work. It's more than 9 years work. It's been going on, okay, for this mosquito control. And if you look into this is actually an extracts. So if you want to work with extracts, first you have to look into the crude extracts, and then you try to work with the crude, whether it's effective or not, and then you work with the delivery mode of that particular extracts. How can we deliver it much more better? And then from there, you can look into the potentials of synthesizing and things like that. But however, okay, if you look into bioinsecticides, why it is effective and all that, because of the multiple component which is exists compared to a single component which is synthesized. But looking into the I would say the shelf life and also the stability, of course it won't be that stable compared to the synthetic insecticides. So here we have tried and we have worked with one publication, and this is actually for the larvicidal effects. So this was our first study, and actually was fortunate to be funded by the FRGS grant that we have tried, and it was very, very effective on the first larvicidal effects of the Aedes mosquitoes, both Aedes albopictus and also Aedes aegypti. And of course, we have looked into the components of the polyphenols, flavonoids, and things like that. I think I'll show it later. And then not only looking into one stage, okay, we have actually looked into the multiple life stages of the Aedes aegypti and albopictus mosquitoes by using these extracts, and it was actually effective, and it was actually giving some good results till recently on February that we have published this paper. It was quite having some potentials for us to develop further, okay, with this nut extracts, these areca cashew nut extracts. I mean, of course, considering we have to look into many factors, like if we were to develop these, what happens to the manufacturing processes, what happens to the toxicology parameters. There's so many things that we have to look into it. But however, when we work with the multiple life stages of the mosquitoes, it was giving a good indication for us. And yeah, okay, not only with one type, okay, this is actually a different types of plant. This was the I think this plant was I was working with this previously. Okay, this is where that the ITEX and MTE that we won medals and all that previously, because this is another type of plant, okay, that we're talking about just now was actually pinang, and this is actually another type of plant. So even in this Azolla pinnata, okay, it's actually a mosquito fern, they call that. So when you look into the literature reviews, why the name mosquito fern? Because it's actually covering up the surface of the water in the field, and it actually like preventing, okay, the mosquitoes. It has something that it can prevent the mosquitoes. So we have worked with this also previously. and worked with a lot of components in there, interesting components that's potential to be marketed, but yet there's a lot of other studies been actually going on. Okay, this Azula pinnata plant as well. And not only that, I think everyone is aware of bunga telang. Okay, this is actually Clitoria ternitis, bunga telang, okay, locally in Malaysia, used in nasi kerabu as well. Okay, so even this plant we have looked before, and we have like looked into the parameters of whether can we use this into control of two types of mosquitoes, is Aegypti and Herbopictus, the vectors of dengue. So even this gives a good good results, and it has some potentials as well. Now, coming back again, okay, what's actually we're talking about here is natural and also synthetic pyrethroids. So just a quick a review. If you're talking about like pyrethroid or synthetic insecticides, they're actually just like your Coke. Okay, it's been actually synthesized. It's the same flavor. You can get it anywhere. But you're talking about like cup of coffee where you get your beans. When you plant it in different region, different country, it'll give you a different active components. So that's the I would say the pro and cons of working with the extracts comparative to working with the synthetic insecticides and things like that. So it's just a general overview. Okay, we everything has a pro and cons, but however, single base compound and synthesized compound generally develop resistance faster in mosquitoes today, and we have worked with that, and we have determined the resistance potency and things like that. So it grows faster comparative to bioinsecticides, which has good potentials to be marketed. So these were the sampling sites that recently that we studied. You know, the first paper that I showed you I published. So we have found these three sites interestingly had some resistance. Okay, we have placed some OV traps. We not only outdoors, we also put it indoors. Okay, because you know, Aegypti is actually indoor mosquitoes. We also put it indoors and all that. We could able to get some mosquitoes. When we come back to the lab, this is actually a standard WHO testings with BioSA. This is the lab scale testings that we wanted to test to see the resistance level and all that. And if you can see, not only a standardized insecticides testings, we also tested on the extracts itself. Okay, from these basic testings that we have done. So extensive testings is just, you know, many forms of testings been done in order to know the possible resistance capabilities and things like that. Now, when you look into the larvicide test, okay, that was actually adults test. Okay, it's like adult mosquito test. This is actually on the larvae. Okay, we don't test on the larvae. So when you look into the larvae, we actually did also follow the WHO protocols and tested against the larvae, and we could see some ingestion is happening in the larvae. I'll show you later. Okay, and not only that, for mosquitoes, we also look into the ovipositions positions, and you know, we blood fed them, and then we wanted to see whether they're actually positioning their eggs or not. And you know, when we give them choice test, that means we over the common water and also the extracts, they did not lay the eggs. And also when we give them a non-choice test, they even lay the eggs on the sucrose solution. So all this happens, okay, in the lab when we study on the multiple life stages of the mosquitoes using all these bio you know, extracts and things like that. Not only that, I think the first plant that I've showed, the pinang or the Areca techu, it has a lot of potentials. So we have conducted in some field trials as well. Okay, we have actually did it extensive field trials, and that's my master student who have just completed her YY and going to submit her final master's thesis. She's done very well in her thesis and things like that. So why? Because of the field trial and all these things. So we have managed to work not only on the extracts, but to somehow rather formulate it into a best delivery devices. So how we're going to do it and all that is we have actually formulated effervescent tableting forms, and it could be you know, use it in the effervescent forms, and it actually dissolved in the water quite effectively, and it was actually quite effective against the Aedes aegypti and also Albopictus mosquitoes. So if you can look into if I were to share a little bit on on the mode of action and all that, if you can look into the midgut and all that, when we apply these effervescent tablet forms, okay, not as a crude extract, but we made it into a tableting form, of course, in collaboration with the members from the Faculty of Pharmacy and things like that. So we could able to see the ingestion in the midgut for the mosquitoes, things like that. It's actually taken from my students' work. Okay. Now, the next slide is actually, we have also tested it against the field site. I think you have seen all the sites that I've shared just now. We have tested it against the field sites, and we have also included some of the commercial insecticides and things like that. If you can able to see that the highlighted parts, okay, on if you're using Termiforce or the existing insecticides, you can see the resistance and all that. So that's where our formulation able to tackle the resistance of these mosquitoes on these 3 different sites. This is actually from the field strains applied in the semi-field conditions, and you can able to see some good results based on that. Okay. Of course, we have also did some work on the compounds. We wanted to see what is the compounds. If you're talking about Areca catechu, it's actually on arachidine, and some of the compounds which we could able to relate it in the analysis like GCMS, LCMS. So much of analysis that we have done, and we can able to detect some of the compounds and components, which is quite useful for us for our future studies. That and this is actually from Azula Pinata, and the compounds from that. Okay, what are the compounds and all that? So we also look into the compounds, and we wanted to see whether we could able to formulate something much more safer by looking into the compounds as well, and also to look whether it's applicable for the industrial scale application, whether we can do it in an industrial package or not. So I would like to give thanks and acknowledgement to all the grants, UMCIE, all the collaborators, Tatin Prof. Indra, Dr. Junaid, and Dr. Fauzi from the Faculty of Pharmacy, and everyone for this extensive work. And of course, thanks for the breakfast session, for the time and slot given to me to share a little bit on my research. Thanks to the research team, some has been graduated, some have finished Viva, and also it's an ongoing effort and a research. These are the patent and copyrights filed from the from some of the work and things like that. Thank you, Dr. Arun.
Thank you, Dr. Rajiv. Is there any question? We can take one question because we both of myself and Dr. Rajiv are rushing to MBBS interview at 8:30, so we can probably take one question, a quick one, please. So if you have question, you can unmute yourself. Otherwise, we'll be happy to pass it on to the next session. Okay, so looks like Dr. Rajiv, you're lucky today. You don't have much questions. So thank you for your attention. We will pass it on to the next moderator, Professor Dr. Anwar. So the screen is yours. All the best, Prof. Azlina. So thank you all.
Thank you.
Okay, thank you, Dr.